Welcome to Raw Online. Today we have a very interesting topic, especially for the Department of Emergency Medicine. This is Tactical Combat Casualty Care Guidelines. Okay, this is recently updated. That is on 25th January 2024. We got the recent updates. Okay, what does it actually mean? Is that sometimes you will be landed up in treating military personnels or people who are engaged in direct shooting sort of things, right? So what is the guidelines in those areas? Okay, so that's called as tactical combat casualty care. Literally, how are you going to provide care at the borders, at the war zones, etc. Okay. So this is asked in DNB Emergency Medicine 2023 paper 4 question 1, tactical casualty combat care guidelines. So this is divided into three major parts. One is the basic management plan of care under fire or threat. That is, imagine that there are two people who are actual in war, or actual in fire. Okay, one person is shooting at the other, and the other person is also firing. Okay, so that is the zone 1 where active firing is taking place. That's zone 1. Okay, now one person has got hit, your team member has got hit. Okay, so from there you need to bring that patient to a field area. That is the plan 2, and from there you're going to shift the patient to a proper evacuation site. That is plan 3. Okay, so plan 1 is at the site of fire, plan 2 is a security area, plan 3 is area of evacuation. Okay, so there are three phases where you are going to treat the patient, and these are the guidelines. This is not only for the doctors or the medical personnel, this is the common guidelines even for the person who is wounded. Okay, so this guidelines has to be known by every, even military personnel also, so that they can compare with your language. Okay, so first, now there are two personnels who are firing, and the one military personnel of your team has got hit. So what should that person do? So, okay, so under fire or threat, return fire, shoot the person back, okay, and take cover. That's the first thing. Okay, and we are expecting the casualty to remain engaged as a military personnel, engaged as a combatant. He needs to continue firing if the situation is appropriate. Okay, when there are a lot of people firing from the opposite end, he cannot walk off, right? So he need to stand there, he need to fix himself, he need to continue firing if for all is appropriate. And whenever chance occurs, he need to move to cover and apply a self-aid if able. Okay, when this tactically feasible, you need to even move or drag the casualty to a proper cover area, and whatever self-aid equipments he has, with that we need to try to control the hemorrhage and cover the wound. Okay, and the major aim is to try to keep the casualty from sustaining additional wounds. Okay, and moreover, if the entire vehicle or that particular area is burning, this casualty should be extracted from the burning vehicles or buildings and moved to a place of literally safety and do what is necessary to stop the burning process. Okay, this is at the area of fire or threat. So fire back, keep engaged in your duty if it's appropriate. With whatever self-aid equipment is present, you need to try to control your bleeding by yourself, and if possible, you can take a proper cover. And if it's in a burning building or in a vehicle, that particular casualty has to be taken out of that vehicle into a proper perimeter. Okay. Now, the stop self-threatening or life-threatening external hemorrhage if it's feasible. Okay. So one is you can use the self-aid equipments whichever is available, or there's something called as the TCCC recommended limb tourniquet for hemorrhage control. Okay. So if it's anatomically feasible, for example, the limb is affected. This is the person and this is his limbs. Okay. Imagine that he is shot in here. Okay. Imagine that he is shot here. This is a person. Imagine he is shot here. So if at all you have a limb tourniquet, you can apply the tourniquet here. Okay. This is TCCC tourniquet so that he can control the hemorrhage at that point of time. Okay. Apply the limb tourniquet over the uniform itself. You did not open up the uniform or the clothing of the individual, because this military persons will be wearing multiple layer of personal protective equipments. So it is not advisable to keep removing everything and directly applying over the wound, right? So you need to apply the limb tourniquet over the uniform itself, proximal to the bleeding sites. Okay. If the site of life-threatening bleeding is not readily apparent, we really don't know from exactly where he is bleeding, because again you need to remember this is not a clear-cut patient, right? He is a military person on uniform. So multiple layer of self-protective equipment will be present. So we might know that the entire limb is bleeding, but we exactly don't know from where is the entry point sometimes, right? In that cases, it need not be only a a short injury. It can very well be a blast injury where we really don't know from where the bleeding comes, right? In that case, wherever you see there is a bleeding in the uniform itself, you need to apply a tourniquet 2 to 3 centimeters just above it, okay? And moreover, understand, airway management is generally best deferred until the second phase, okay? There is no room for airway management in the area of fire, okay? So, we divided this into 3 zones. One is the phase 1, that is the area of fire itself. Second is the field care zone, and third is the evacuation zone, right? So, in the first zone, we are going to control only the hemorrhage, okay? So, you fire back, take cover, use the self-aid equipments and use a tourniquet and take cover and move out of this burning vehicle. This is what is involved in your during the